This is A Drugless Life. Podcast by Dr. Paul Bekkum and All Seasons Full Body Chiropractic Center. Using alternative, complementary, and integrative medicine to help you live a drugless life. We get you back to doing what moves you.
Okay, Sari, what are we talking about today?
Today, we're talking about TMJ.
That's a mouthful. No.
And we have a guest, somebody from our office.
We have Dr. Mark Jorgensen here today.
Hey, welcome everybody. What a fantastic topic. Should we explain what TMJ stands for? That's probably a good place, huh? So TMJ means temporomandibular joint, and what is commonly known, mostly in the dental world, is when you're talking about the TMJ is temporomandibular disorder, and we're going to talk a little bit about that with Dr. Bekkum and some of the experiences we've had. Myself, over 30 years in practice, and Dr. Bekkum, what, 20?
Coming up on 26 here.
26. So we've both seen a lot of things, and what I've come to find out recently is had the good pleasure of putting on a presentation with a dental group made up of dentists and hygienists down in Fergus Falls. As I was opening the segment and talking to them, there is a very, very large gap in understanding of what really is the cause of TMJ problems, or TMD, and they really don't have any answers. Dr. Paul, is that been your experience? What would you say? I was really shocked.
Yeah, I mean, you're going to get the traditional medical kind of model of anti-inflammatories, maybe some muscle relaxers. Maybe they're going to use some
ice,
occlusal guards. Ice, yeah. They might have ice, but from there, it's pretty much it. I mean, there's not much that's really looked at as far as even what's going on. Obviously, people have pain and all that sort of stuff, and discomfort. They might not be able to open or close their jaw. Lots of just dysfunction, and that's what we're really looking at in the office here and trying to help improve, is to get your jaw functioning properly, and that should even help get rid of some of the pain. So,
well, and I'm just thinking, for a lot of people, they're probably not even noticing it in the beginning, and their dentist might be the one that notices it, right? Because they're probably noticing some wearing and tearing on their teeth, and they're suggesting that they put a mouth guard in. And if the dentist doesn't know that this is something that can totally be prevented through, that it's a musculoskeletal problem, they're really not getting to the root core of what it is. So talk more about that piece.
Well, I guess we can kind of get back to just literally what are some of the signs and symptoms that a person does have temporomandibular syndrome. So there's the syndrome, which encapsulates all of this stuff here. The TMJ, what most people think of, is literally just labeling the jaw. It's your temporomandibular joint. So there's basically 12 major signs and symptoms that you might have temporomandibular syndrome. If you have more than 3 of them, basically it's going to give you a diagnosis of temporomandibular dysfunction. So the first would be pain in the TMJ. The next would be crepitus, or kind of creaking and cracking, in the TMJ joint itself, not necessarily with the teeth or anything like that.
Clicking and popping.
Clicking and popping is what most people are going to think about there. Bruxism. What's bruxism? Grinding your teeth at night. That's what the dentist might notice, because they're going to start to notice some wear and tear in your teeth. You might be having pieces of your teeth that might, the enamel's going to start to break off more down at the base of the tooth. So that's what they might be noticing in a dental type practice. Like I mentioned before, the inability to basically open up your mouth. You should be able to open up your mouth at least 3 fingers. So usually it's your second, third, and fourth finger, and you should be able to open up your mouth and stick those 3 fingers. And if you can't open it that wide, then you're having some.
We need to do a visual of this.
Yeah, we need to have a
he's
video.
He's just literally sticking his fingers in his mouth as he's
Hopefully
telling
you
this
can
story.
sense that over the audio here. So, the other thing is the inability to close your mouth. A lot of times we've had patients that have been into a dental office and they've had their mouth cranked open for a long time, getting dental procedures done, and they're unable to close their jaw. I mean, we can get into why that happens in a little bit here, but so if you can't open or close your jaw, the 6th one would be having headaches. The next one after that is going to be neck aches, that upper neck. There's a lot of muscles and connective tissue that's connected in between the neck and the jaw there. Some people are going to possibly experience tinnitus or ringing in their ears with or without dizziness. People will also have tracking patterns of their jaw. So if you look at your jaw in a mirror and watch it open, it should go straight down. Like your teeth should stay in line from open, or from completely closed to open, and also from completely open to closed. I would call it more like an S or a C pattern if you're having some dysfunction, and that could mean a couple of different things. S patterns usually are a muscular type problem, whereas a C pattern is an articular disc, or the bilaminar disc that sits on top of the condyle of the jaw that is getting stuck in front of or in back of the condyle of the jaw. Other things that can happen are chronic, just recurring cervical subluxations, especially in the upper cervical spine. The vertebra in the upper cervical spine, there's muscles and all that that attach onto the jaw as well. Another thing is just muscle weakness, especially during range of motion, of opening and closing the jaw. So we're going to test some of the muscle strength of the jaw and see if you're able to perform that without weakness. And some people can have some ocular dysfunction, so their eyes just won't, they'll have some problems seeing. That's kind of a rare thing, but that can happen. So those are the 12 different signs there. So
was dizziness mentioned? I forgot.
Yes.
Dr. Paul.
Yep.
So
with tinnitus, you can have dizziness or not have dizziness. So,
I think one of the things on Monday night that I really got a grasp of was that we've kind of ceded problems with the jaw to the dental profession, when it really doesn't belong there in a large part, because we think the proximity of the teeth, that hey, if I have a problem with my jaw, a dentist would be the one to talk about. Actually, that really is something that's been a disservice to the public. And as I've done work over the years from a chiropractic perspective, using my cold laser, percussor, these types of things, I've had, I think, exceptional results with it. And I just come and just realize that the public is really left in the lurch with not having a go-to profession. And I really believe it's us as chiropractors, especially with our training that we have.
Yeah, I would say that 99% of probably the other chiropractors, in the area here, really don't know how to even treat TMJ type problems. I guess it's something that I've been treating for, I would say, most of my career. A lot of people that would come in with whiplash have TMJ type issues. That's one of the last thing that's going to move in a whiplash type incident. You're going to get that jaw moving, and a lot of times it's, you don't have control over it because of the forces involved there, and it just causes a lot of problems. I mean, that's where they get some of the dizziness, headaches. Even think of people that are in sports like boxing and mixed martial arts and stuff like that, where they're getting hit in the face and end up having TMJ type issues, upper cervical issues that need to get cleared up. And if you're just literally trying to clear up the spinal aspect of it there, you're completely missing where maybe the problem's actually coming from. It could be actually even coming from the jaw. I find that in a lot of other parts of the body as well. So that's where we'll have, hopefully, people showing up in the office here so we can kind of screen them out. And we have, like I say, multiple different screening procedures that we use in the office here with the jaw. There's some specific screening procedures like we just kind of mentioned, where we'll check all of those different signs and symptoms that a person might have going on, so that we make sure that we are addressing all of the issues that a person does have.
So what if there's a dentist listening right now to both of you? What would you suggest as the process, referring somebody over to you if they feel like, hey, they've worked with somebody with a TMJ problem, it doesn't seem to be getting better? What would be their next step?
Well, I think in kind of discussing this here, I think there's a simple questionnaire that people can kind of fill out that we could even supply the dentist there, that they could have their patients fill out, see if they actually do have some of the signs and symptoms of temporomandibular syndrome or temporomandibular dysfunction. And it's a scored questionnaire, and it could be something that the dental offices don't have to do. We could work something out with them where they could fax it to us or email it to us with the patient's information. If the patients do have things that score above kind of a 15% on there, we can contact the patients then and let them know that, hey, they have something going on that needs to get evaluated a little bit further here, and might be simple, might be more complex. We don't know until we get the person in the office here and evaluate them, to give them as a clear a treatment program as possible. So
I think our goal really is to become an area resource center for people who struggle with TMJ and jaw problems. And again, especially for the dentists, since the dentists are probably going to hear about a great majority of these jaw problems. We want to be that. We want to be another tool in their toolbox that they can go to. It's like when I was speaking the other night, I said, if a patient comes in and they've got a tooth problem, I'm sending them to a dentist. I'd like to know if a dentist has a patient sitting in front of them who's complaining about jaw pain and what he thinks is a TMJ problem. He can call up All Seasons Chiropractic and be confident that their patients are going to be taken care of professionally, screened, and that there'll be a good communication between our office and their office so that the patient gets the best care.
So, I mean, I guess, do we want to get into a little bit more even of, I don't know, how deep we want to go with a lot of this stuff here? I mean, if there's some dentists listening and maybe some patients, they might want to know a little bit more of, what really does happen when they do have a TMJ type issue. I mean, like we discussed before, there can be some tracking problems, and typically that's related to, the articular disc. It's a bilaminar disc. The best way to kind of even think about it is almost like an inner tube on a tire that's sitting literally on top of the condyle of your jaw. And what can end up happening is if that articular disc, which could happen on one or both sides, can get stuck, especially in front of the jaw there, that will not allow the person to open up their jaw properly. If it's on one side, you'll typically see a big C pattern, and the jaw will deviate towards the side of where that bilaminar disc is getting stuck. If it's stuck on both sides, they're not going to be able to open their mouth. They're not going to be able to get their 3 fingers inside of their mouth to be able to open their mouth properly there. The other issue is literally with, being at a dentist and not being able to close their mouth there. They could have that articular disc getting caught back behind the condyles of the jaw, and we need to literally kind of lift that condyle of the jaw back down, allow that bilaminar disc to kind of go back up on top of the condyles of the jaw there to allow the jaw to close properly. And most of the time it doesn't take very much, yes, to get them back to where they should be at. Usually we can be fairly specific as far as how long it might take to get them back into proper function just through our evaluation there. So
you pretty much just conduct a screening, and then through that screening you can find out the severity and then build a treatment plan based on the severity of their problem then.
Yep. I mean, there's people that, even people with dentures, people have had, implant dentistry type done, because it's going to change just how their jaw and their mouth works. So it's going to affect everybody a bit differently. So, just like with any area of the spine, I mean, people can have, looking like the same thing going on, but it's actually a completely different problem too. So getting into that, I mean, there's also different things like myofascial trigger points that can cause referred symptoms, where people can have, the headache type symptoms that they have going on. There can be, some vascular issues if the muscles get too tight, or there's some restriction there, and that's where, again, you might get migraine headaches. That's where you can get some of the ocular dysfunction as well.
So somebody who has migraine headaches, there's a possibility that it's a TMJ issue?
It
Absolutely.
could be, it could be
That's
one of the components of a migraine headache. So that's, again, why we want to be able to screen out all this stuff here to make sure that we're not missing anything and that we're not so focused just on the spine being the problem, and find out that there's actually a, temporomandibular joint dysfunction. There's maybe some myofascial trigger points that maybe need to be dealt with. So, we're trying to assess that as thoroughly as possible so that we can find the actual cause of the problem there. So,
and if somebody is interested and they're thinking, well, I'm not sure if I have a TMJ problem, but I might, what is the next process with the office here?
Well, they can, one, go online and, go out to our website, which is just drpaulbekkum.com. And right on the website, they can request an appointment from there. It'll contact the office. Obviously, you can pick up the phone, give us a call, 701-356-0016, and, talk to the receptionist there, and she can get you set up for that initial, consultation and assessment to find out if, what you have going on with your jaw could be something that we can treat, and we'll give you a pretty good idea of whether or not we can help you or not.
All right. Well, thanks everybody for listening. And until next time, hope you enjoyed our talk on TMJ.
Thanks for listening to A Drugless Life, For further information or to set up an appointment, visit our website at drpaulbekkum.com or give us a call at 701-356-0016.